Accurate assessment and diagnosis are essential steps in effective mental health care. This module introduces the tools, techniques, and processes used by mental health professionals to identify mental health disorders. It covers clinical interviews, standardized screening instruments, observation, and the use of diagnostic manuals such as the DSM-5 and ICD-11. You will understand the importance of comprehensive assessment for planning treatment and supporting recovery. By the end of this module, you will be able to explain the purpose and importance of mental health assessment. Describe the main methods used for mental health evaluation. Understand key diagnostic criteria for common mental health disorders. Recognize the role of standardized screening tools. Appreciate the challenges and ethical considerations in diagnosis. Purpose of mental health assessment: to gather comprehensive information about a person's emotional, psychological, and behavioral functioning, is to identify symptoms and their severity, to differentiate between different disorders and rule out other medical conditions, to guide treatment planning and monitor progress. A clinical interview: the foundation of assessment involving a structured or semi-structured conversation. Key elements include presenting problems, psychiatric history, family history, social and occupational functioning, substance use and risk assessment, for example, suicide risk. Building rapport and trust is crucial for accurate information gathering. Observation: noting the person's appearance, behavior, speech, mood, and cognitive functioning during assessment. Behavioral observations can reveal symptoms not explicitly reported. Standardized screening tools and questionnaire. Examples include PHQ-9, depression, GAD-7, anxiety, MNSE, cognitive function, and audit, alcohol use. These tools help quantify symptom severity and monitor changes over time. Diagnostic manuals, DSM-5 and ICD-11. The Diagnostic and Statistical Manual of Mental Disorders, DSM-5, and the International Classification of Diseases, ICD-11, provide standardized criteria for diagnosing mental health disorders. Understanding key criteria ensures consistency and accuracy in diagnosis. Differences and updates between manuals may impact diagnosis. Challenges in diagnosis: overlapping symptoms among disorders can complicate diagnosis. Cultural differences may affect symptom presentation and interpretation. Risk of misdiagnosis and the importance of ongoing assessment. Ethical considerations: confidentiality, informed consent, and avoiding labeling or stigma. Multidisciplinary approach: collaboration among psychiatrists, psychologists, nurses, social workers, and other professionals. Yes. In summary, this module has equipped you with an understanding of how mental health professionals assess and diagnose mental health disorders using clinical interviews, observations, standardized tools, and diagnostic manuals. You've also learned about the challenges faced and the ethical considerations involved. This knowledge lays the groundwork for understanding treatment approaches in future modules.